most appropriate next step in management of this patient. So, 56-year-old woman, metastatic breast cancer, fever, shortness of breath, tachycardic, hypotensive, decrease in platelets, increase in D-dimer, prolonged PT and activated PTT, or yeah. Fibrin degradation products are elevated, diagnosed with DIC. Which of the following is the most appropriate next step in management of this patient? Okay, so she is basically in DIC. You tend to have like, okay, I struggle with like the blood products, but I'm gonna do my best. So basically you have like bleeding from like your IV site. You have like, you can't properly clot. So we need to give her something to help her with like prevention of clotting. So or with to assist with clotting. So treat the underlying cause. I think we need something more emergent right now. And then, okay, I think it's gonna be A or B. But honestly, I get the two confused. I might do cryoprecipitate, but I don't, it could be either.
Okay, so actually, it's kind of funny, right? Because they always say, like, in DIC, we always get so focused on replacing things, right?
Yeah.
That actually fixing the thing that's causing the DIC is going to actually be your first initial step, actually. So, they sometimes test this because it's kind of a semi, trick question. You know what I mean? In a sense that, you're so focused on the bleeding, right? You're so focused on that, but you got to stop because DIC is like so bad. You know what I mean? Like it's like chasing, it's like putting a bunch of band-aids on such a horrible problem, right? Like putting a band-aid over a bullet hole, right? Probably not the best way to deal with that. So you want to figure out what's causing the DIC and like fixing that almost ASAP,
Yeah.
right? So if it's the chemo, stop the chemo. If it's the radiation, stop the radiation, right? Like you got to stop that stuff, or else like it doesn't matter how much cryoprecipitate, they're gonna still be in DIC, right? But talking about the rest, right? So, cryoprecipitate replaces fibrinogen and other clotting factors with severe bleeding, right? Maybe in some DIC, but you want to treat the underlying cause. FFPs, also something you can use. Heparin, not typically used, right? You're already bleeding, right? So probably not great.
Exactly. It just make it worse.
Yeah, gonna get worse. Administration RBCs, this is always, in a in your mind that you might have to give to people in DAC. But when someone gets in DAC, you want to figure out ASAP like what's causing it, and if you can, then stop that, right? If you can't, then of course keep giving them the band-aids until you figure out what's going on. And sometimes you can't, and a lot of times these patients can die, right? um but definitely for sure, figure out what's going on and treat that.